I am Dr. Adam, and with the Bright Minds at Beatrice, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters.
I wonder what's keeping Bill and Phil.
Not sure, but today's appointment sure is an important one.
Sure is.
I'll tell you one thing though, with the ills, you can always count on hearing them first way before you see them.
Indeed.
Hey Dad, let's grab some lunch after this.
Yeah. Fried chicken or burgers or pizza?
I don't know. I can't decide. One of those won't be enough though, right? I'm so hungry.
Let's just have them all.
Yay! And then we get dessert.
Discussing food choices, are we?
Uh-huh.
You betcha. How's it going, Dr. John? Oh, Doc! What do you want to talk about? We kind of have eating plans we need to get to, if you don't mind.
Exactly what we need to talk about today. Your eating plans.
Those can wait a couple of minutes, Bill. Please, have a seat.
Dad, what's going on?
Shh. Okay, Doc. What's up?
Bill, we are worried.
Dad, what are these guys talking about?
You see, Bill, your eating habits might be rubbing off on Phil here.
Oh, you bet they are. That's my boy. He knows how to enjoy food, I'll tell you that.
Or in other words, Bill, it's Phil's one-way ticket to obesity.
No way. It's just baby fat, Doc. He's still my little munchkin.
Stop!
Bill, this has nothing to do with age or baby fat for that matter. Obesity is defined as an abnormal or excessive fat accumulation that may impair health. In 2016, more than 1.9 billion adults 18 years and older were overweight. Of these, over 650 million were obese.
Oh, but how?
Obesity occurs when there's an imbalance between energy consumed and energy used. Energy from food, that is.
Consuming high amounts of energy from foods that are rich in fats and sugars, coupled with lack of physical activity, will lead to surplus energy being stored in the form of fat in our bodies.
That means you've got to change your plan, boys.
Dad, what are these guys talking about? Is this true?
My boy is obese?
What?
With the kind of eating plans you're making, Phil's on his way, I'll tell you that. You see, the main part contributor to obesity is a poor diet. Eating things like packaged or fast food is a big contributor. Drinking sugary drinks, Phil, is a big contributor. Or in your case, Bill, drinking too much alcohol.
Having larger portions than needed can affect your health, and also eating out all the time. You don't control the portions or the ingredients there. And that's not the only contributing factor. Many of us have jobs that involve sitting it out the entire day, and then there are those of us who watch TV or surf the internet, lazing about for countless hours, munching on whatever we can find.
You know, it is recommended to do 30 minutes of exercise 5 days per week, at least.
Well, we play football. Sometimes.
We went to the park too.
Yes!
It was once though, a long time ago.
Yeah.
Another factor is genetics.
What?
Certain genes inherited from parents can increase the chances of being overweight.
Dad, this is all your fault.
But then again, it can occur due to poor eating habits and lifestyle choices, mostly. So relax, kid.
There are some medical conditions that are known to lead to obesity.
And that's where we step in.
So, he has some junk here and there, but so what? Chunky but funky. Positive self-image, Doc.
Yeah.
True, but there are a lot of implications that come with being obese nonetheless.
The most prominent ones could be cardiovascular diseases, which could lead to a heart attack or a stroke. You can develop diabetes and other diseases that might affect the muscles and joints of the body.
You can increase your chances of getting some cancers, including breast, liver, and kidney. Your chances of getting high blood pressure, mental illness such as depression, and sleeping disorders increases. You can learn more about those in our other episodes. In addition, childhood obesity is associated with a higher chance of premature death and disability in adulthood.
Oh my Dad!
Docs, you're freaking him out.
But not to worry, we can prevent that. Being moderately active helps maintain a healthy weight.
Hey, cut that out!
Following a rich, nutritious diet made of fruits, vegetables, and whole grains gives us healthy body weight. Eating 3 meals a day with limited snacking.
Keep the intake of saturated fats, alcohol, and fast food limited, but include small amounts of high-fat, high-calorie foods as an infrequent treat. Identify and control triggers that lead to out-of-control eating. Use that diary.
Regular monitoring of body weight will help us detect even small weight changes. But don't get overly obsessed though. Body weight changes almost on a daily basis.
Being consistent with a healthy diet plan will increase your chances of preventing unhealthy weight gain, Phil.
We called you in this time, but it's important to identify when to seek help on your own. Seek out help when you don't know how to lose weight or are unable to.
Or you are concerned about the effects of a weight loss diet or about increased physical activity on your health. And that's when we check your BMI.
Uh-huh. And BMI is what exactly?
Body Mass Index. It assesses weight relative to your height and is calculated as weight in kilograms divided by height in meters squared. Obesity is defined as a BMI of 30 kg per meter squared or more.
To make a diagnosis, a doctor will record your medical history, conduct a physical checkup, and then recommend some tests if your BMI is in the obese range.
They may also check for other health problems commonly seen in people who are obese. Once all assessments are complete, the doctor will determine the required amount of weight loss and treatment.
So, Phil, what did you learn today?
I need to change my eating habits and be more active.
Fizz! Didn't you hear everything the doctors just said? I am appalled. Come on, Phil, let's go get some chicken and salad. Yeah, maybe kick the ball around the park too, without Fizz. Ignoring everything the doctors just said. We're getting you a one-way ticket to Health Central, Phil, buddy.
Let's do it!
Another thing, behavioral therapy works wonders. Mental health specialists or psychologists can help here. And that's pretty much all you need to know about obesity. Here's a quick refresher in case you build it and didn't catch our drift.
To make a diagnosis, a doctor will record medical history, conduct a physical checkup, and then recommend some tests if BMI is in the obese range. The doctor may also check for other health problems commonly seen in people who are obese. Once all assessments are complete, the doctor will determine the amount of weight loss and treatment needed. You know your health matters. You can visit the below website to gain more information on health and wellness and access the Health Matters with Dr. Adams' series of videos. If you feel you need further healthcare and wellness information, you may consult with your family doctor.